Good morning, Molly.
Good morning. Can you hear me?
Yes, we sure can. You're all set.
Thank you.
And welcome, Amanda. Good morning.
Good morning.
We can hear you. Thank you. And Taylor, good morning. Taylor,
Good
if
morning,
you can
everyone.
hear
This is the clerk with a courtesy reminder that this meeting is now being streamed live on the internet.
Hi, Dave. Can I do a mic check?
Chief, we can hear you. This is
Great.
Jill. Good morning.
Oh, good morning, Jill. Thank you.
My pleasure. And good morning, Chad. Welcome.
Good morning.
Good morning. Veronica, if you'd like to do a mic check.
Good morning. Thank you.
Thank you. Supervisor Ellenberg, good morning.
Good morning, Jill. Happy August.
Thank you. Your clerk today will be Dave Leon.
Thank you. Hi, Dave.
Hello, Supervisor. How are you?
Good, thanks. How are you?
I'm well, thank you.
Excellent.
If there's anyone who just came into the room and would like to do a mic check right now would be a great time.
Good morning, everyone.
Thank you, Sylvia. We can hear you. And Charles, good morning.
Good morning.
Loud and clear. Thank you.
Hi, good morning.
Good morning. Thank
Good
you.
morning.
Thank you.
Those of you joining us, we're at 9:59, and here is our vice chair to get us started. Good morning, Supervisor Wasserman.
Recording in progress.
Good morning.
There you go. And it is 10 o'clock. So I am glad to call to order this meeting of the Public Safety and Justice Committee on August 4th, 2022 at 10 a.m. And I will turn to our clerk, Dave Leon, for a roll call vote, please.
Good morning, Vice Chairperson Wasserman,
Here.
Chairperson Ellenberg.
I'm here. And Dave, your voice is very faint.
Oh, How's that? Is that better?
Not much.
I will turn my mic up. Give me just one moment.
Okay,
Okay, how's that? Is that better?
that's much better. Thank
Okay,
you.
thank you.
All right, we're going to move to item number 2, which is public comment. Public comment is that portion of the meeting that's reserved for members of the public to speak on issues that are not on today's agenda, but are within the purview of this committee. Do we have any speakers for public comment?
We have no hands raised, Madam Chair.
All right, let's just give that a quick second. I did say that fast. And if we still don't have any members of the public, then I will move us to item 3.
We do not.
Okay, terrific. Supervisor Wasserman, I would like to recommend for addition to the consent calendar today, item 6, which is the video arraignment program report from the Office of the County Exec. Item 7, which is the custody health grievance report, and item 8, which is the report from the Office of Gender-Based Violence Prevention on the Domestic Violence Shelter-Based Programs Special Fund. Is that all right with you? And do you have any additional items to add or remove from the
Oh, ma'am,
consent?
and I'm happy to second that motion to add 6, 7, and 8.
Thank you so much. I want to make, before we go to public comment, I want to make just 2 requests related to item 7, which is the custody health grievance report. I was really glad to see the update on the planned patient satisfaction survey. And I'd like for updates on the implementation of those surveys or findings from those efforts to be included in each quarterly update on grievances. And I see Protima nodding. Thank you. Second, the custody health regular reports to the Health and Hospital Committee focus on COVID updates, but I know that there are many, many other initiatives underway in custody health related to restructuring, expansion of services, CalAIM preparations, and integrated behavioral health services. So I'd like to ask that the general updates from custody health summarizing major department activities be reported either quarterly to PSJC or integrated into the existing monthly HHC reports so that we can all keep a pulse on the breadth of activities of custody health and how they're supporting people in our custody. Should I look to, I see Protima nodding again.
Will do.
Dr. Day want to weigh in or you're speaking for her and we're good?
Yes, Chairperson, Dr. Day is away today and I'm speaking for her. Thank you.
Perfect. Thank you so much, Protima. Do we have any public speakers on the consent calendar?
We have no public speakers on this item, Madam Chair.
All right, let's have a vote on the motion that I made and that Supervisor Wasserman seconded.
Vice Chairperson Wasserman
Aye.
and Chairperson Ellenberg.
Yes.
Thank you.
All right, thank you very much. With that, we are going to move on to item 4, which is the jail population and court backlog reports. And let me start before I turn to, I think Casey's nodding, or Martha. I really appreciate the staff providing the written reports this month, and I look forward to seeing this continue in the future. I do recognize that involves extra work, but I see it as a really worthwhile endeavor that provides a more concrete and accessible record for the public to review. Managing the jail population and the court backlog is something that I know is a priority for all of our PSJC committee members and staff. And I think that it's important that the community sees the work that's happening. So thank you to Casey, to administration, and all of the department leads who worked on providing these written reports this month. It also means that we don't need to hear from each department verbally unless there's something to add beyond what is in the report. And I'd like to turn directly to questions and comments with the agreement of Supervisor Wasserman.
Yes, ma'am. Sorry, I was trying to find my unmute button.
No worries. And do you have questions on any of those department reports before I go into a few?
No, I do not at this time, but I think your comments were excellent. Thank you.
Thank you very much. So I do have a few. I want to thank the departments that reported metrics of success, and I'd be interested to see all of the departments include metrics on efforts to reduce the jail population and backlog in future reports wherever that's possible. I also want to note that some of the statistics that were provided, while really good reporting, were point in time stats that didn't really offer sufficient context to show the comparable magnitude of that statistic, or if it's part of any trend. So in addition to future reports, including metrics from all the departments, I'd like to see those metrics reported over a period of time, kind of in the way that the jail population statistics are presented. So I'll look to Casey to ask about the feasibility of this request for metrics and displayed over time.
Thank you, Chairperson. Yes, we can work with the departments to ensure that you have some context to the monthly metrics so that they can go back and you have some comparison. So we can work with the departments for that.
Great, thank you so much.
You're welcome.
I also have a couple of questions regarding the dashboard, which is a really helpful tool to show the status of our departments and the court's collective effort. There were two histograms on the report. The first one showed the average monthly size of the jail population, and the second showed the number of monthly bookings. And I really appreciate the breakdown, but I found that the first histogram had a much shorter y-axis than the second. So it was really difficult to discern any difference in the statistics reported from month to month. And I'm wondering, just from a technical perspective, could we have a longer y-axis in future reports so it's easier to see differences from month to month?
Yes, I think that histogram is completed by pretrial services and also our team at TSS. So we can work with them to see if we can mock up something that's a little bit more user-friendly for our members here.
Great, thank you. And my final request regarding the dashboard would be to ask if we can have similar statistics reported for the size of the court backlog. I appreciated the really thorough reporting that the district attorney provided this month on the time not waived cases and the really tremendous effort the courts have been putting forth the past few months to reduce the backlog at an increased rate. Is that possible to get from the courts?
Supervisor Ellenberg, good morning. It's Judge McGowan. Good morning, Supervisor Wasserman. I will try not to take up so much time as I did when we met in June. Our statistics are up to date as of this morning, and I'm happy to share them with you. I also do need to make a very slight and what might seem insignificant correction to the report from the district attorney. So if you'd like me to do that now, I'm happy to do that. Or
Please,
if this is not the right time, I'm happy to wait as well.
Now is perfect. Thanks.
Okay, so frankly, the court backlog does not really impact the jail population so much because the backlog is primarily in misdemeanor cases where those parties are out of custody. Our current backlog as of this morning is 478 backlogged cases, down from 547 in July. Of those 478, 370 are misdemeanor cases with more than 330 out of custody. So those are not impacting our jail population numbers. As you know, of course, the court does not speak to any public policy discussion about reducing the jail population, but we are more than happy to share that data and information with you. With respect to the district attorney's report, because we are backlogging civil cases by diverting resources to the criminal division, we need to be accurate with that because of the civil impact. So it's actually under then presiding judge Eric Gaffon back in August of 2021, a civil judge was assigned full-time to criminal trials. That first department was Department 10 Judge Roberta Hayashi at DTS. One civil judge has been doing criminal trials then for a full year. In December, also under then presiding Judge Gaffon, a second civil judge was assigned to the criminal division to backfill any vacancies or absences so that no criminal department would go dark. And then the report references another department in May, and that is correct. Civil is now donating a second judge for misdemeanor trials to the criminal division. I want to be clear to share this impact because the civil division only has 6 trial judges to start with. And the single biggest obstacle to the court right now is the shortage of deputies. In the time since we last met at the end of June, the court closed 2 courthouses and 11 departments so that deputies could be diverted to the criminal courthouse to keep those departments up and running. Those 2 courthouses and 11 departments still remain shuttered for lack of deputies. Supervisor Wasserman will be delighted to hear that we did now get an increase in the court's budget. So although it is not FEMA stepping in to save the day, we are very pleased to announce that we have gone from only being funded at 82% of our need to the new budget, which has now been signed and is final, which will take us to 91% of our need. So with that, the court should be able to open 5 additional courtrooms this fiscal year. But for the fact, of course, that we've already closed 11 more because we have no deputies. So we are working closely with the county to try to come up with some alternative security positions so we can, in fact, keep metal detectors open and courtrooms open. But I thought it might be nice to, for once, share some good news. So the backlog is down, the courtrooms are down, but the funding is up, and I look forward to more positive reports in the future.
Thank you so much, Judge McGowan. That is some good news. Supervisor Wasserman, you want to add a comment?
Thank you, Chair, and thank you very much, Judge McGowan. That's great. I was making notes, as you said, the backlog went from 540 down to 478, but more importantly, I think for at least my conceptualizing of the issues in the jail is your point that out of the 478 backlog, only 148 are actually in custody. Only 30%, 70% of that backlog are not in custody. And I think that's a key point that I never understood before. So I appreciate that very much. And I also appreciate the 10% increase in your budget, which was well deserved. Thank you, Madam Chair.
Thank you. And that brings to mind then another question, Judge McGowan, of the backlog. Are the cases where folks are in custody prioritized, or is there a different priority setting?
Our backlog cases are our priority now. Much depends on the status of the discovery of those cases and whether they've been through their preliminary hearings. We are prioritizing preliminary hearings so that 2 departments will be opened hopefully very soon and running full time. And currently we pull from trial departments to make that happen. We're attempting to fully staff that out so that we will not have to interrupt a trial to do a prelim. That may be more detail than you want, but the short answer is yes, we're trying to prioritize every backlogged case.
Thank you. You're rarely going to find a situation where there's more detail offered than I want. I find this to be fascinating and really important to the residents of our county. So thank you.
Well, here's one more detail that no one is interested in but me. The court is experiencing a complete network outage at the downtown Superior Court today.
Oh, no.
So if you'll please understand if I can't stay with the meeting, I'm currently trying to reroute parties and judges to other courtrooms. And I rerouted myself back to my home office dining room table so someone could use my courtroom. So please understand if I have to beg out early, but I'm certainly willing to answer any questions that you have.
Thank you so much. I am sorry to hear that. I want to also, while we're looking at the departments and you referenced the DA again, I just want to recognize the District Attorney's Office for their really substantive monthly reports on their efforts, which also have highlighted new pilots and innovations every month. I really think our county has much to be proud of in our justice agencies, setting national examples for what restorative justice and alternatives to incarceration can look like. And I appreciate the District Attorney's Office being at the forefront of that. Let me turn back just briefly to administration, or maybe the District Attorney or Judge McGowan again, to just get clarification of the possibility of future reports, including the size of the court backlog added to the monthly dashboard.
Well, I would ask Judge McGowan, I'm happy to work with you to do that. I don't know if it would be easier, Your Honor, to have those reports come directly from the courts, or if that's something that you would do with the District Attorney's Office. I'm open to either suggestion.
As am I.
Thank you. I appreciate that. I'm afraid it might still have to be from the court in the short term at least, because we are in the process of creating our own dashboards. The court does not use CJIC anymore. And that's why my information was only received in the last few hours to provide you with the backlog. We still have someone creating it by hand while we transfer to a dashboard system. And Supervisor Ellenberg, just because I may not be able to stay, could I jump ahead to two other issues where the news is also something I should probably share? I know video arraignment was something that was to be discussed. And I just want to point out that the court is currently still in negotiation with our interpreters union. And we do not have a process that has been successful for video interpreting. So just for the sake of everyone on this call to be able to discuss it, our current process is any detained individual who currently requires the services of an interpreter must be physically transported to the courtroom. That is, we think, an opportunity for some improvement, but that is currently the status of our union negotiations and all the court is able to do. So I just wanted to put that out on your agenda. And then finally, as with every other county in the state, the court's zero bail schedule did expire this week at the end of July, and the court is returning back to the bail schedule that was in place for this year. The bail schedule is typically voted on each year, and I suspect that by January, we will have yet our latest updated bail schedule, but I did want to make sure everyone understood that zero bail did expire by its own terms at the end of July. That concludes any report I have.
Thank you very much. It also concludes my request for data from the administration. I have a few remaining questions on the sheriff's report where I'd like some clarification. The report notes that participants of the Custodial Alternative Supervision Unit electronic monitoring program, the ELM bracelets, attend 60 days of programming at the Reentry Resource Center to get 7 days off of their sentence. And can you just clarify, Sheriff Smith, does this mean that participants are in custody for the 60 days of programming, or are they in the community during that time and showing up to reentry every day for programming?
They are not in custody. They show up every day for that program. And some have ankle bracelets also.
And so what does it mean then that they get 7 days off of their sentence if they're already not in custody and they complete the program? What does the 7 days off of a sentence mean?
I don't know if we have someone that can answer that question, but obviously when a person, they are actually considered in custody, but they go home, so they have the same benefits as the in custody people.
So it means that the electronic monitoring might be removed 7 days earlier. Is that what it?
No, what it means is it means that their length of sentence is decreased by that period of time. If they were sentenced to 30 days and we monitored them during the 30 days, it's 7 days off that 30 days, if you will.
They have 30 days, potentially -7 if they do 60 days of programming. How does the 30 and the 60 fit together?
I was just using it as an example.
Right, but go walk me through that example then.
Okay, if they're in custody, let's say for a year, and they get credits taken off. So, I mean, days taken off. And so when you subtract those days, as of that day, they're out of custody.
I might need to draw it out, but I won't take the whole
okay.
time to understand, for me to understand that when others may find it to be clear already. The other issue where I'd like clarification is on what qualifies somebody to be screened for eligibility in the program and what qualifies them for the program itself. The report mentions that changes were made to the screening process to maximize the number of participants.
there are certain things that they're sentenced to that we won't consider them for the program, but we look at the overall person and determine who it is that we believe can be successful in this type of program.
And what are the criteria for being successful? Is there a sheet that you could share with us off agenda, or what information can you provide so that we and the public can understand who qualifies, what's being looked at?
Yes, we'll provide that off agenda.
Okay.
We have people, all of our staff right now is in use of force training, and they had stepped out for this item and then asked to go back into their training. And I said, yes. So I will give you an off agenda report and how we're doing those assessments.
Thank you very much. I was surprised truly to see you sitting there by yourself. Now I understand why. Thank you very much. Before we move on to the next item, I just want to make a brief comment, really recognizing the visionary work that our county PSJC departments have been doing to improve public safety and justice systems, address root causes of crime, recognize the centuries of manifest and well-documented cruelty of the U.S. criminal justice system that has really created many of the inequities and the drivers of crime that we see today. And I want to call this out in the context of these reports today for talking about reducing the jail population. This work is so important because 91% of the people in our county jails have been charged with a crime, but they have not been found guilty. And our data consistently shows us that releasing them into the community has little risk to the community, with reoffense rates around 5 to 7%. And as all of you know from your work so well, that when people are unnecessarily held in custody pre-trial, the unraveling begins. Families, jobs, housing is all jeopardized, which often creates greater harm in terms of our community and public safety. So because of the systems that we've had historically, we continue to turn to incarceration as a way to remove from our presence poverty, homelessness, mental illness, and substance use disorders. But we have learned so well, I think, that locking up people who are unwanted removes the problem from the visual range of residents, which of course may be enough for some, but it's a short-term Band-Aid with often dire consequences. We can't jail our way out of these social problems. And I absolutely recognize that victims who have been assaulted or robbed or had their car or home or business broken into feel the need to turn to retributive justice as the solution, in part because it's the only option that they've been offered. But restorative justice solutions that our county is really courageously promoting are proving to be effective alternatives to incarceration that can meaningfully hold people who caused harm accountable to making restitution, as opposed, again, to our traditional system, which focuses on punishment and rarely addresses the root causes of harm, nor does it act as an effective deterrent. Our county has demonstrated, I know to the consternation of some, an ongoing commitment to reducing our jail population, among other strategies, to create a more compassionate and equitable and root cause driven paradigm of achieving public safety and justice. And I want to just express my gratitude to all of you for that. I will look to our clerk to see if there are public comments on item 4.
We have no speakers, Madam Chair.
Then we'll move to item 5, which is the ATI work groups update. I'm really glad to announce today that the County Alternatives to Incarceration, ATI work groups, will begin meeting in September in order to get members acquainted with each other and provide a space for some much needed initial trust building and connection, and to celebrate the launch of the work groups. We will be hosting, my office will be hosting an in-person social and optional kickoff event in early September, to which all work group members and PSJC committee members are invited, and my office will be in touch with more details. I'm also going to take this opportunity to introduce our new facilitator for the work groups, with whom some of you may be familiar. It's the Resource Development Associates, often called RDA, with which administration has finalized a contract. RDA is an Oakland-based woman-owned business that has facilitated numerous community engagement projects, including for the San Jose Mayor's Gang Prevention Task Force, the Alameda County Care First Jails Last Initiative, and our county's Behavioral Health Department. My office and administration have been working closely with RDA to schedule small focus group introductory interviews, smaller than the 3 work groups. I think we've got about 7 of those, to gather work group members' input on what they would like to see come from the process. Since all of you, the PSJC agency leads, have a tremendous amount on your plates, we opted to hear your input during this time that's already on your calendars, rather than scheduling a separate focus group time for PSJC committee members. So to kick us off, I'm going to turn to the RDA team to introduce themselves and facilitate this conversation and hopefully get some input from all of you. So Megan, it's all you.
Thank you, Chairperson Ellenberg, and good morning, everyone. My name is Megan Drazek. I am a senior consultant with RDA Consulting. So as mentioned, we will be the facilitators for this series of ATI work groups. So while we're here, I want to introduce the rest of our team. So my co-facilitator will be Dr. Kidd, so I'll let her introduce herself.
Hi, everyone. I'm Taylor. I will be co-facilitating with Megan. I am a consultant here at the Justice Practice, and I look forward to working with everyone.
Wonderful. Thanks, Taylor. And we also have Dr. Charlene Taylor here as well, so I will let her introduce herself.
Good morning, everyone. Charlene Taylor. I am the director of the Justice Practice at RDA. For this particular project, I'll be providing just some support and oversight for Megan and Taylor and anything else that the project needs. So I look forward to seeing how the work groups go, and it's nice to meet everyone.
Awesome. Thank you. So we have 2 brief items today. The first one, I really wanted to just provide an overview of our timeline since we have gotten started on this work, and then we'll jump into the open discussion that Chairperson Ellenberg had mentioned to get your input on what you're expecting out of this process. So to start with the overall timeline, we are using the month of August to finalize the work plan and really come up with the objectives that we're hoping to achieve for each work group session, so we can have that ready to share for you for the September meeting. So we'll be able to walk through that for you guys. So that means we'll be conducting monthly meetings with each work group from September through February of 2023. And so during that whole time, we'll be coming to the PSJC meetings to provide you regular updates on what we're working on and what we're hearing. And then in March of 2023, we'll begin to share a preliminary presentation of the findings and recommendations that the work groups are coming up with. And as the work will still be ongoing, it will be preliminary. So we're going to spend the rest of March and April continuing to meet with the work group members to really finalize and hone those recommendations and findings into a final report for you that we can present in May of 2023. And then we'll take that to the Board of Supervisors in June of 2023, at which point our contract will be done. So that is the timeline. Are there any questions on that before we move into the discussion?
Nope.
Wonderful. So that leaves us a good amount of time. We have 3 questions. They can be very large, but we'll take them one at a time. So please feel free to jump in. We'd love to hear any input that you guys are willing to offer. If you agree with someone, please feel free to +1 something if you want to tag along. So we'll start just 1 question at a time. Our first is really, we want to hear, what expectation do you have of the ATI work group series and the report that we're hoping to produce coming out of this?
Madam Chair, do you just want us speaking up, or what is your pleasure?
Please do. I don't see any hands, and I'm hoping that you'll just get us started, Supervisor Wasserman. If
Thank you.
for some reason it gets chaotic, we'll raise hands.
I'll be very brief and succinct. I don't have any preconceptions of solutions, but I am very optimistic that these efforts will result in some solutions. The title is self-explanatory, alternatives to incarceration. I think that's very important. I think there are solutions out there. I think there are best practices throughout the United States that we could learn from, and I'm optimistic that your meetings and the input that you receive will result in more solutions to benefit Santa Clara County.
Thank you. I see people are raising their hands, so I'm happy to call.
Well, they all want to chime in now that I've come up.
There you, that was the
Speak.
point. You could have been a shill, Mike.
Exactly.
Let's go to Assistant District Attorney James Gibbons Shapiro and then Public Defender Molly O'Neill.
We're excited to be part of this work group in this process, and we're hoping that the discussion is both going to be about alternatives to incarceration and also to think about and recognize the times where incarceration is appropriate to protect public safety and for individual accountability. And sometimes the discussion only focuses on one part of that, and we're hoping it focuses on both.
Thanks, James. Molly?
Good morning, Supervisor Ellenberg, and thank you. I just want to call out the jail population.
It's hard to hear you. Sorry, can you come a little closer? Thank you.
I might have had some. Can you hear me now better?
A little bit.
Let me see if I can get closer and turn my volume up. I apologize. I don't mind shouting. Okay. I just want to, can you hear me now?
It hasn't changed at all. Shouting would be great.
I don't know why on earth I haven't had this problem in a year. Okay, so I'm going to shout. Can you hear me now?
Yes, thank you.
This will force brevity. You'll all be happy to hear. So I just wanted to call out the jail population this morning is 2,804. It's been climbing. Never mind zero bail. It's been climbing steadily for the last year. And so we as a county have done excellent work together and collaboratively. Can you still not hear me?
We can hear you. We're straining.
Okay. And so my expectation and hope for this work group is that we are able to do what we've done well in the past, which is work together. And really, I wanted to address the second question too, which is what concerns I have. And the concerns are that we'll spend a lot of time talking about solutions and not implementing them. So I really want the follow through to be as robust as the discussion and the work plan. Thank you.
Thank you. And there, I'll add a comment, but I want to make sure I'm not jumping in front of anyone else for the first question. Chief Garnett.
Yeah, I'll jump in really quick. We too are really happy to be a part of this. We actually feel like we would like to be part of at least two of the work groups and maybe all three. I think we're only slated for one right now. And my hope is that not only do we get kind of more balance, but we also just get different voices. I mean, I feel like we keep having sessions and that's my biggest fear. We're just going to keep talking about this for the next several years and be running in place. And that just gets really, really frustrating. I think we need to focus and move. And if we do it wrong, then we'll correct and refocus. But I really like to get to the doing part sooner than later.
I'm trying to be the last speaker, but I just want to give that hearts. And yes, we need to absolutely be biased toward action and here are programs. And that's to me the advantage of doing this with county and non-county representatives. There may well be programs that already exist or that have the potential to exist with funding and support that we're not thinking of. And I think that that we absolutely have to be committed to action and a report that ends up saying, here are 2 or 10 or 20 programs that we can and should try. And hey, Board of Supervisors, policymakers, fund directors, let's get it going. So thank you for that. Matt Fisk and then Dr. Smith.
Yes, I'd just like to add, like Chief Garnett said, pre-trial and admin booking, they participate in all 3 parts of that continuum. So if we could be part of each one, that would be great. And then glad to see the interaction with Los Angeles. And I admittedly haven't worked as much with Alameda County nor San Mateo County, which is not on that list, but I would call to your attention San Diego. They're doing some really good things. And in some ways, both Los Angeles and San Diego are a few steps further down the path. So they might arrive to some conclusions that could help us expedite some of the things.
Fantastic. Thank you. Dr. Smith.
I would just want to ask the consultant to keep an eye on what kind of partnerships need to be forged in order to make the changes that the committee eventually comes up with. I think we all know that, you know, criminal justice is probably not working very well because there are too many hands in the kitchen. You know, we've got the state, the feds, you know, a bunch of regulatory agencies, counties, cities, everybody with their own concept. So if we're going to come up with an action plan, I'd like the consultants to make sure we identify where the action needs to occur, whether it needs to occur at the state or federal level or county level or city level or police level or whatever, because it's not something the county can fix unilaterally.
Thank you. That's important insight, Dr. Smith, and I agree. And everyone should know that the committees do include city representatives as well, and law enforcement entities, as well as community advocacy groups, nonprofits, and county. Thank you for that. Javier.
Good morning, Javier Aguirre, Officer of Reentry Services. So I think one of my expectations is that the ATI work groups can help better, that we as the county departments can help better explain to the community the work we already do and organize existing county services that are already considered alternatives to incarceration. And then I think we need to really foster the collaboration with our courts, the district attorney, law enforcement agencies, as having them champion and support these alternatives to incarceration. And I think very importantly is also that the report that comes out of this identifies sustainable, realistic programming with housing component. It's when I was looking at the ATI work groups and information from LA County, they did a very comprehensive inventory of all county funded beds targeting vulnerable populations. So that's something that we should definitely do. And then lastly, another expectation of mine and the ATI work groups is that we should incorporate an equity lens when planning stages of policy, process change, program evaluation, and development. Thank you.
Thank you so much, Javier. And to your comment about knowing what the county is already doing, I want to share, and hopefully you've seen a draft of it. My policy aide for public safety and justice, Auden Young, has been working for months on essentially a primer on what alternatives to incarceration means, specifically what you talked about, what county programs already exist, and hopefully all of the background that's necessary so that we can all start at the same starting line. And if you haven't seen it, we'll make sure to get it to you. We want to make sure we have input from all of the departments so we're not missing any of your programs. And then we will get that out to all of the committee members prior to the first meeting.
Thank you.
Thank you. Sylvia.
Yes, so I think in addition to what everybody else is saying, I am hopeful that the work groups provide a forum and an opportunity for information sharing that can both help creating innovative solutions, but also build trust among our systems as they currently function. Because while our systems currently have issues that we need to fix, which is what we have this work group for, my sense and my hope is that, as Matt mentioned, there is a broader understanding of what we do, of what the system can solve and what we can't. Because I feel like a lot of the times we have, for example, in our work with communities are sometimes just disenchanted and upset that our system is so flawed, which it is, but not to the extent that they believe. And sometimes just sitting in a room where people understand how the system functions and what we do well and what we need to improve on is going to be key. So I hope that at the end we have solutions, but also we have a better communication stream that isn't just, the community is communicating via this forum, but that we have better working relationships with community members so that they know what our county offers and what our county does that does work and what areas exist that we need to fix. So that's what I hope.
Thanks, Sylvia. I would agree that I think trust is going to be the first and biggest hurdle.
Huge.
There is a lot of concern and distrust amongst community advocates and people who care very much about this issue, particularly seeing the increase in the jail population, for which I understand there may be many, many reasons, will be seen as contrary to our stated philosophy and policy of trying to reduce the population. So I think climbing that wall to trust is going to be perhaps the most significant part of the work and won't happen quickly. I was reminded also that the Division of Equity and Social Justice, to Javier's point regarding an equity lens, will be involved and will be reviewing recommendations. So we will all make sure to keep that front and center. Any other comments on the first question? Supervisor Wasserman.
Thank you, Madam Chair. And I want to thank James and Sylvia and Javier for the comments they made. Yes, the title for the committee is, alternatives to incarceration, but I think the trust and the communication, the education of what things are currently being done and why they are being done. I think, Sylvia, the points you just raised are excellent. And that was my dog, Coco, echoing her appreciation for your comments as well. Thank you.
All right, Megan, looks like we're ready for the second question.
Wonderful. A few concerns have come up through sharing on the first question, but I do want to give a space for any other concerns that have come up that are percolating for you for looking forward to these work group sessions and the outcome of it.
James.
I've appreciated the list, and I know it's being amended for the membership of the work groups, and I think it's really good to be involving so many county departments and agencies. I think the thing that is a challenge for any effort like this, and that I hope that we lean into that challenge and really make an effort, is to seek out people who are not part of the regular county agencies and the voices that we might not typically hear because the people are at work, because the people have a difficult time attending these kinds of meetings. This kind of outreach for additional input, I think, is going to be important because otherwise we'll be a little bit of an echo chamber talking to each other.
Thank you. Sylvia.
And along those lines to what James was saying, I believe that part of this trust building, communication improvement, educational process is about adding broader expertise. So because we're going to have such divergent perspectives, right? The community that thinks, we as administration folks, county, we're not doing anything, zero, our system is terrible and awful, versus us that are like, well, we're doing this much. I think that wide gap sometimes is well filled with the expertise, the voices of those that are experts in the field, the newest, most improved resources and better strategies. In other words, begin with an educational base, because if we begin, frankly, from this is our current state, and the fighting, as James mentioned, is going to be, and the disagreements are going to consume a significant chunk of our time. And while that's important for the trust building, as I heard a lot of my colleagues mention, I am also incredibly concerned about the lack of practical, applicable relatable things that we can apply soon rather than wait years. And as you know, we've been part of a reform process in the past. The juvenile justice reform effort was successful in this county, but it took a decade. And we just don't have that time. And so we need to learn from the lessons of that time period, which was similar to this. We had disagreements, community did not trust us, and we had a mountainous, undertaking. And that took a long time, but we just don't have the time here. We have significant crisis. So I feel like that's what I would like to see is the facilitators need to give us the objective data, the educational piece, so that the community as well as us can gain different perspectives and then, sort of create and craft our solutions that are unique to us, but using it as a foundation.
Excellent. Thank you, Sylvia. Javier.
One of the concerns that I have is we may not place enough focus on the key drivers of who is sent to jail. We could discuss programming and services, but I think it's very important that we always look at our partners at the courts and get judicial buy-in as much as possible to identify the best options. And I know there's a lot of statewide initiatives that have included superior courts from throughout the state who are looking at these type of initiatives. So we should bring those suggestions into this conversation and also solicit local buy-in from our courts. And then I think also importantly, the comments were raised earlier about engaging the community. And, I think sometimes we have difficulty in bringing other voices to our meetings, but maybe we need to go to their meetings. There's a lot of community meetings that are already established that would love to hear from us. And also in both the Vietnamese and the Spanish speaking communities. So I think that's something that we need to ensure that we go to those communities. And, just been working with Supervisor Wasserman with the South County policy team, and something that we also have to look at the South County area, especially in Gilroy, where we have one of the largest, poor communities and neighborhoods. We could leverage existing efforts that we already have to engage communities impacted in South County.
Thank you. I really appreciate all of the comments. Anything else? A concern that I have, frankly, is how this is a hard one to say, but we have to be really bold in this work. I think there are going to be concerns about the facilitator not coming from the community, being an agency that the county has worked with previously. I'm concerned about perceptions of bias, frankly. So I want us to be prepared for that. It is an awkward thing to say, but I think not saying it really denies that this is going to be either an explicit or implicit issue that I think needs to be acknowledged head on.
Okay.
Molly.
Thank you. I switched my mic. Can you hear me any better now?
The same.
Okay, let me try one more time.
Maybe try turning your camera off in case that makes a difference. Sometimes it does.
Okay. Is that any better?
Yeah, it is slightly better.
Okay. Let me do one other thing.
No, it's the same.
Is that any better?
No, it's exactly the same. Sorry, just shout.
Okay, I'll be brief again. So I just want to say this out loud, and it's hard to say as well, but I think we need to be mindful in the process that there is a lot of alarmist rhetoric coming from certain places that could be a red herring or an impediment to actually doing this important work. So I think we need to kind of keep that in mind, respond to it where appropriate, and really call out what is incorrect or alarmist without supporting data that could really get in our way. And I personally will not let it get in the way. I know it's alarmist, but I wanted to say it out loud. Thank you.
Okay.
Supervisor Wasserman, can I just hand the chair to you for 2 minutes? Thanks.
Yes, I was just getting off of the mute. Molly, thank you for your comments. We'll turn back to Sylvia now.
You know, I think Molly has a good point about that as I mentioned earlier, there's going to be two extremist views on both sides. But one of the things that I'm hopeful will also be added as part of the conversation and part of the educational tools and kit that we will have is data. And that is often the biggest challenge to obtain current and accurate and reliable data, because when we have extreme views and we're going to have angry emotional positions and reactions from advocates and people that we are traditionally going to be adversarial because that's what the system is designed to do, and now we're going to be in a different setting, the real arbiter between that is data that is trustworthy and reliable. And I feel like if we don't have that, then we are going to have a lot of time spent on either validating or denying the emotional, visceral, human reactions of people that are part of our groups, and that we're not going to be able to, you know, undermine or negotiate their emotions. That's what they are. But to get to the solutions, we need to be able to then rely on something that is concrete. And that's going to be the difference between a political rally and a professional workshop that is about concrete solutions. And so I think I hope that if we are going to have a facilitator, that the facilitator is empowered by the current data that demonstrates kind of where we are in the system.
Thank you. Thank you for that. I don't see any other hands raised. Megan, why don't we go on to your next question?
Thank you. The last question is
and what
really,
are the odds of having two people on your staff with Taylor in their name?
I know, and they're both Dr. Taylor if you use first or last name. So
there you go. There you go. All right, please go ahead.
I'd love to hear if you have been involved in prior efforts related to alternatives to incarceration or prior work groups kind of doing a similar objective, maybe even in a different area. I just would love to hear if you have thoughts on how you want this particular work group series to be different from those prior efforts.
Wow. All right, our chair Ellenberg is back. So I will turn the lead back over to her. And you just asked a very open-ended question, Megan.
Thank you, Dr. Smith.
Well, I think it's important to point out that both from the juvenile side and the adult side of the criminal justice system, the county and many partners have been working on trying to find alternatives for decades. And there have been many meetings, many work groups, many efforts. As was mentioned earlier, we made significant progress in the juvenile side by getting our incarceration rate of wards way down from around 300 or 400 now to in the 80 range, which is a big deal, but it took a generation of work to get that done. And so I think one of the challenges for the consultants will be to realize that lots of people have gone through lots of meetings and have come, to certain conclusions that will be challenging to deal with. It's got a lot of history, and so we'll have to acknowledge that history and acknowledge where we've been before and acknowledge that this is not a new subject, but it's a not solved subject yet.
Chair Ellenberg, maybe?
Yes,
All right.
thank you. Yeah, James. And then Laura.
Yeah, I just wanted to agree with something Sylvia said a little bit ago and amplify it a little bit. I think that so often in other efforts, we haven't taken the time to really thoroughly understand the systems we're talking about. And because all of our agencies and different groups really are expert on the thing that we do and maybe not on how the broader system operates and how all the other players do, that we can find ourselves talking past each other or using terms that different groups use as a term of art and mean something specific, but now it's being used in this committee in a different way. And as a result, we're disagreeing with each other because we don't even agree on the same language. So I think if we, I'm hoping that we spend a good amount of time explaining to each other how the systems work so that when we start talking about ways to improve them, we're not talking past each other or we're not misunderstanding what we're talking about.
Thank you. Chief Garnett. You're muted.
Sorry about that, every single meeting. So I agree with most of everything that's been said. So yeah, and I've worked in this area for 30 some years and have a lot of opinions about how to do it right and how to do it wrong, but I won't go through all that. So I see it kind of as a three-part thing where we have to start with areas of commonality and somehow stop the polarization, or we're just not going to get there. We're going to spend so much time being polarized, we're not going to solve anything. And that area of commonality should be based on shared values, and that it's worth the time to learn each other's systems, not exhaustively, but enough to be able to make educated decisions. And to get to shared values without that being 50 meetings, because we always have more in common with one another than we think if we can put down our armor long enough to have the discussion. And then I just feel like, you know, our executive team works on a consensus basis and has the whole time I've been here, and it really works. But sometimes I feel like when we're doing public things, I don't know, maybe I just think of consensus as different. We really look at it as like, can you live with this? Not, is this your 100% your best first thing, but can you sleep tonight? Do you feel, you know, good enough about the decision that you can live with it? And if not, then let's keep talking. But like, maybe we could define what success is. And it's not going to be that every person is ecstatic about what happens. And it's not going to be that bad things aren't going to happen. Bad things happen in custody, out of custody, but whatever we do, I think this area of commonality, the shared values and consensus building means when good things happen, we share the success. When bad things happen, we share the risk, and that we stand together, and that we're able to do that with the community, and that we just focus really hard on those things. And I think we can get anywhere if we have, you know, a foundation set up like that.
Thank you. Beautiful. Any other, Javier?
You know, I think just 2 points. One is once we've established some agreements, then to the point Chief Gardner saying about measuring success and defining success, but it's also an agreed upon way to report back on progress to not only to this body, but also to the community, and in terms of letting them know the progress we're doing moving forward. And then lastly, and we've had the fortunate to work with RDA about 7 years ago in terms of preparation for our AB 109 Public Safety Realignment program. And so one of the things that I've learned with working with consultants is the importance of incorporating visuals and flowcharts. It is so important. Like, you could write reports with 5-7 pages of just narratives, but if having some visuals and flowcharts can represent and allow the community to understand it. And those are easily can be then translated into Vietnamese and Spanish, and then share that with our communities. So I think that's something that I would really look forward to, ensuring that any reports and progress reports include visuals and flowcharts. Thank you.
Excellent, thank you. Any other comments? All right, Megan, I hope that was useful as a starting point. I'll turn back to you for any final comments or wrap up.
Thank you. No, thank you everyone so much for sharing. This is incredibly useful, and we understand this is not the first step in your journey. So it helps us to catch up and kind of be able to place our planning efforts where you guys are coming from. So we really do appreciate you sharing everything today. And we look forward to getting started and continuing this conversation with you all. Thank you so much.
Good. Glad you're still looking forward. Glad you already signed a contract before hearing that this is not going to be an easy road, but I think it's extraordinarily worthwhile. So
don't scare away quite now.
Do we have any public comment on item 8?
We currently have no hands raised, Madam Chair.
All right, we'll move to item 9, which is a report from Reentry Services on 10 years of public safety realignment and reentry services. Take it away, Javier.
Well, good morning. And again, Javier Aguirre with Officer of Reentry Services. So I'm going to do a brief introduction, and then I'm going to have Chad Martins, Program Manager with Officer of Reentry Services, to do the presentation. Just to remind this committee and the community that we've now have had 10 years of working under public safety realignment, the development of hundreds of programs and services that have impacted the lives of thousands of individuals seeking opportunities upon release from jail, and those that are incarcerated. And we just look forward to what is to come. And so this report is just a preliminary report that provides high-level outcomes and observations from timeframe of October 2011 through December 2021. And then we're working with all of our internal partners and our external partners, a lot of our community-based organizations that have been providing a lot of services to our clients, in a full report that we're hoping to publish and release in the fall of 2022. So with that, I'm going to turn it over to Chad Martins.
Javier. Good morning, Supervisors Ellenberg, Wasserman, and committee. So as Javier mentioned, this is a preliminary update on the 10 years of realignment and related initiatives, focusing more on the front end stuff so we can come back to you in the fall with the full report and really delve into the services. Okay, so just a quick refresher on the realignment population. There are 3 sub populations or classifications within that. First is PRCS, or post-release community supervision. These are the folks that are lower level felons released from prison, and they are released into county supervision instead of parole. So they're coming from prison into our county. And then we have the 21170H classifications. And as you may be aware, 1170H penal code allows people to serve their felony sentences in county jail rather than prison. And so they can be released as straight sentenced people, so they're not released into supervision, or they can be released on a split blended sentence, meaning they're released into a special probation unit where they're supervised after release. So in terms of how that looks on a release timeline, we've been reporting this to PSJC for quite some time. So as you may remember, releases have been declining over time when we look at it by quarter, but overall, over 9,000 individuals have been released under AB 109 since October 2011, as of December 2021. And that accounts for over 12,000 releases, as some people are released on multiple AB 109 grants. And then in terms of how we look at this population in terms of their risk and need, one of the best sources of data we have comes from probation and their case risk assessment, or their correctional assessment and intervention system assessment. And so the chart on the screen here shows you kind of a year-to-year look, and we see that the AB 109 population year-to-year and overall is majority high risk, meaning they are going to be a bit more challenging to serve. So not only do they have or often have a history of frequent offenses prior to becoming AB 109, after they are assessed post becoming AB 109, they are still considered high risk, and overall about 75% were assessed as high risk, and only about 3% were found to be low risk. And of course, this only pertains to PRCS and 1170 MS, as those are the folks on probation supervision. So when we drill down a bit further, some of the people who get the case assessment get a principal needs assessment. So there's a deeper level of that assessment that looks at their principal needs, or in other words, their primary drivers of criminal activity. And so over 2,000 men got this assessment, and over 250 women got this assessment. And as you can see, the top 5 principal needs differ between men and women, but alcohol and drugs, as we've seen before, are by far the biggest principal need or most significant need and primary driver. However, there are a lot of other needs this population has, such as criminal thinking, behavioral needs, cognitive behavioral needs. And so the implication here is essentially, yes, this population is going to need a lot of treatment, behavioral health interventions, cognitive behavioral interventions, but they also have high rates of homelessness and unemployment. So we have to factor that in as well to really provide holistic support. And then finally, there is the engagement component. So as we can see, the majority of this population is going to need some type of substance use treatment. However, they may not be ready to engage or commit to treatment. And so it's been worthwhile, and it's going to continue being worthwhile to invest in ways to outreach this population and support them and help motivate them. And then when it comes to recidivism, we've done a analysis for the full 10 years now. And just a reminder that our recidivism rate is anybody that commits a new conviction within 5 years of their AB 109 release date. So they're convicted on a new law violation within 5 years. It was a bit higher for men at 49% compared to women at 43%. So getting into recidivism as a whole, again, we looked at it over the whole 10-year time frame. So overall, about 9,400 unique individuals were released under AB 109. And as of December 2021, 40% of these individuals had committed a new law violation within 5 years of their AB 109 start date. Now, when we looked at when we did the initial 5-year analysis in 2016, we found that about 45% of the people released between 2011 and 2016 had recidivated. So to kind of get a sense of where we're at now, we looked at the next 5-year period, 2016 to 2021. And we found that when we kind of mirror the first analysis, that rate is now 41%. So that's promising. It means that the recidivism rate does appear to have gone down between that first 5-year period and the second 5-year period. And then when we look at the whole 10-year period together, we get a 48% recidivism rate. So one of the things we want to look at is how we can best compare this rate to other jurisdictions, other populations. It looks relatively low overall, but it is very difficult to compare because we do a longer analysis, and a lot of rates don't look at the AB 109 or similar populations. So we're going to be looking for more information to bring back in the fall. And then in terms of classifications, PRCS and 1170 straight folks tend to recidivate at similar rates, while the 1170 MS folks have the highest rate of recidivism. And then when it comes to the types of crimes people are committing when they recidivate, or the AB 109 people are committing, the majority of the recidivism is occurring at the misdemeanor level. So about 1/3 of all recidivism was felony, the rest was misdemeanor. And then if you look at the chart on the right here, it's broken down by type as categorized in CJIC. So CJIC has kind of built-in categories, and we can see something that aligns with the principal needs section is that drugs were by far the most common type of recidivism. At 31% of all violations committed were directly drug-related as categorized in CJIC. So that number is probably a bit undercounted just because there are other crimes that are technically drug-related but aren't necessarily categorized as so, such as crimes where people may be driving under the influence or similar. They are related to drugs but not categorized as such. So when we look at drugs and theft and fraud combined, that's over half of all recidivism. And so as we know, theft and fraud, or people often commit crimes of theft and fraud to support drug use. And so those two are going to be interrelated as well. So as we saw in the principal needs, we have an additional data to kind of support that, drug and alcohol use is really the primary driver here and the main area of focus in terms of clinical services. So when looking at time between release and rearrest, 82% of rearrests were before the 1 year mark. So this is just showing us when people are caught relapsing or recidivating, but it's just another indicator that we really need to address this population as early as possible, whether that's pre-arrest, post-arrest, within the courts, in custody, and of course in the community. And then we also wanted to just give some quick partner highlights to showcase some of the amazing work our partners have been doing. The medical mobile unit, well, as you might notice, some of these timeframes are a bit different due to changes in databases and whatnot, but for example, the medical mobile unit over a 5-year period or a 4-year period rather has served just under 6,000 unique patients. So a lot of people are getting medical and psychiatric services out of the reentry locations. Then we have the Sheriff's Custody Alternative Supervision Program. They were able to supervise over 1,000 participants in their alternative supervision program where people are serving their sentence in the community rather than in custody. And they had a 74% success rate overall. So another indicator that alternatives to incarceration are going to be viable and important. And then we have the Public Defender's Reentry Expungement Program on the top right. Between September 2013 and 2021, they were able to clear the records of over 5,000 people and over 10,000 convictions overall. So a lot of reentry clients and a lot of justice involved folks are getting more opportunities through programs like this as they can apply to jobs and pursue additional opportunities. And then when it comes to Reentry Resource Center, Social Services Agency, their reentry unit has always been our most utilized partner. And between February 2012 and 2021, they were able to process over 20,000 applications, leading to over 9,000 households receiving benefits. So that's a really important part of our one-stop shop. It's one of the most crucial first steps to get people assistance and get them back on their feet. And then of course, there's Office of Supportive Housing, which this committee knows housing is extremely important. And so their reentry funded or realignment funded programs were able to serve over 1,200 people between 2012 and 2021 and permanently house over 400 households. So a lot of important work being done there. And then finally, another highly utilized partner at the Reentry Center is the behavioral health team. This team, when somebody comes into our centers asking for drug alcohol services or mental health services or treatment, this team will assess them and then link them to services in the community. So between 2016 and 2021 or 5 years, they were able to serve over 11,600 people and make over 4,000 referrals to substance use treatment and mental health treatment. So a lot of good work being done there as well. That concludes the updates. And then in terms of next steps, as we mentioned, in fall 2022, we'll be coming with a more detailed report. It's going to have more information on what was presented today, full sections on each initiative funded by AB 109 partners and programs, additional findings like survey results and other relevant information related to reentry services. And then of course, we want to align between now and then with our partners and come up with some recommendations for how this adult reentry network can move forward. And then finally, we think it's really important to put a face to all this work that's being done. And so we do collect client success stories, and we want to include several of those to really showcase from an anecdotal perspective how these services impact people's lives. And that concludes my update. We're happy to receive any questions.
Thank you so much, Javier, and congratulations on 10 years of service. Do you mind closing your screen so that we can all see each other? Again, thank you. I have just two questions. The 30%, 31% reoffending drug violations. Can you talk a little bit more about that? Are they possession, use, sale? I understand that I thought I understood that law enforcement was doing significantly fewer arrests for drug possession, but tell me a little bit more about that.
Sure, my understanding, and I do have it all broken down by actual violation, which I can provide if you'd like to see that. It's a long list because there's 45,000, but it's all broken down, and I'm happy to share that with you. From my understanding, it is mainly crimes of possession and paraphernalia and being under the influence. However, there are some drug sales, charges or convictions wrapped up in there. And in terms of law enforcement reducing arrests, I think, because we're looking at the 10-year period, I do think we would see a slight decline in the proportion of arrests, but because there's a lot of other factors at play, that's something we can definitely look into and kind of, revise for the final report in terms of how we break it down.
Thanks, Chad. I think the distinctions are important because if we're looking at, people with substance use disorders, they are unlikely to be dissuaded by arrest and jail time. That's part of what we're talking about. And related to that, on the partner highlights page, I noted 4,255 referrals to treatment. And I'm curious if there's any tracking on who actually goes into treatment, what the success rate is, are beds or slots actually available? We know one of the challenges that we have is insufficient supply of treatment resources. So can you also address that piece?
Absolutely. So in the current section we have on that, we do have information on success rates for admissions. So we do look at it. We don't have data that directly connects referrals to admissions, but we have data that looks at all admissions for AB 109 folks and then the success rates of those admissions. So we can definitely look at opportunities to also kind of connect the rest of the dots as well.
Thank you. I would wonder if there's any correlation between not finishing a program and higher likelihood of rearrest, or the inverse, finishing a program less likely to be rearrested. If we're really looking at root causes, I think that would be an interesting rabbit hole to go down. Thank you so much. I really appreciate the report. Supervisor Wasserman.
Thank you, Chair. Thank you, Chad. Thank you, Javier. Each time it comes up, the 10-year anniversary, I go back 11 and a half years ago, and the whole concept about bringing the Reentry Center to Santa Clara County. And for those of you, many of you on the screen today were here then. I see Sylvia nodding her head. We're here back then, and we got it started in San Jose. And I remember a few years later, we got into how we measure recidivism versus how the state measures recidivism, how LA measures recidivism. And there were about, 8 different ways between all the municipalities, maybe half a dozen different ways that they measure recidivism. And Javier, a conversation you and I had about 8 years ago was, you know what, we're going to define it the way we define it. And then we can measure, because, pick some way to define recidivism and then measure year over year using the same measurements. And then you can tell whether or not you're improving things. But I know when it first came up, I remember the 5-year anniversary, and you all have so much to be proud about our system and the reentry system. But I remember the state coming down, giving us an award because we were the best practices in the state, and our numbers were going down. And the state they came, Javier, I remember the person being here, said, Santa Clara County, what are you doing? And they wanted to tell other counties in the state what we were doing so they could start with us as a best practices. And then when some dollars and opportunity came along, we opened a second one in South County, where I think per capita, there's as much need as anywhere in Santa Clara County. And then Javier, you and your team recognized various gang issues that resulted in people not coming to the Morgan Hill location. And then you moved it to Gilroy. And then the number of people that would attend was greater than ever before. So I think where you've started, where we are now, where we're headed is all super. I still think we're the gold standard in the state. You're always looking for better, and Chad and Javier and everybody else, thank you very much. I've been there from the beginning, as I know many people on this screen have been, and doing a lot of good work. And the numbers, depending on how you measure recidivism, were somewhere around 60 and 66% of people recidivized back 11, 12 years ago when we made the argument to open a reentry center. And if we're down around 50%, you know, that with every recidivism, there's a victim. And so every percentage you bring it down is one less victim. And all the people that have gone through the program and successfully morphed, if you will, and to be able to support themselves and their loved ones, those are all success stories. So I just want to say thank you again. Each and every time something comes up about the Reentry Center, I am so proud of all of you and Santa Clara County. Thank you, Chair.
Thank you, Supervisor. Sylvia.
Well, I'm actually very, very proud to be a member of this committee and to see this great success. And I'm actually very grateful and thankful for having Javier as such an effective leader in our county that has maneuvered and stewarded this project through with, I think, a combination of both the sort of intellectual capacity to manage this amount of information and data, but also the innovation to let the data sort of drive the direction of the program, but without losing sort of the sense of compassion and commitment to serve the human beings that are behind the data and behind the numbers. And I think that if we just had a bureaucrat that was all about numbers and wasn't compassionate and didn't think about the human beings behind it, this wouldn't be the same, and they wouldn't be the same success. And so I am very proud that this county has taken such an innovative approach in looking at, like what you have mentioned, Vice Chair, in terms of community outcomes means reducing crime and reducing victimization and improving the lives of the offender population. So there's a lot for us to be thankful for, and I'm really proud to call you as a colleague, Javier. Congratulations.
Thank you, Molly.
Thank you. Thank you.
Thanks. How's the microphone now? Any better? All right.
Poor Molly.
Go ahead.
So I just wanted to mention in 2011, right after Realignment passed, Jeff Rosen and the sheriff and I met with a couple other people along with Governor Brown to kind of talk about a realignment money. And he said in a very long 2-hour conversation that his intention was to allow flexibility with the realigning of the prison population. And so lots of counties took that money and just made jail beds in their county jails rather than in state prison. We, on the other hand, very intentionally, under Javier's great leadership, took the money and tried to help people get out of the system rather than just put them in a different bed. And it's been, you know, it's been tremendous to be a part of. We've had our expungement project over across the street for a long time. And the numbers, I mean, I think they're even more extraordinary than Supervisor Wasserman called out, in that parole had about a 66% violation rate, but they only looked at a 3-year period. We're looking at a 5-year period. So the longer you give people, the more likely it is they're going to get in trouble again. So I think our numbers are even better than they appear on paper. But I just wanted to shout that out because we didn't build more jail beds, and we're continuing the struggle, and the struggle's real. So thank you.
Thank you. Any other, Javier?
Oh yeah, just wanted to thank you for the attributes, and I couldn't have done it without an amazing team, Chad leading our contracts and evaluation group, and all of the folks at the Reentry Center. I think one of the proudest moments too is making sure, like Sylvia said, being compassionate and being empathetic, but also hiring staff with lived experience and making sure that the clients that come to the center can really feel comfortable in explaining their needs and services. And when I look back, when the Reentry Center was first envisioned, it was at a meeting with the sheriff, behavioral health, and the county executive's office, and facilities and fleet, and envisioning what would come together in terms of what we have now. So we could not have done that without the countless partners we have here at the Reentry Center and at the community. So very much thank you.
Thank you so much. Do we have any public speakers on this item, Dave?
We have no public speakers, Madam Chair.
All right, moving on to item 10, which is announcements from committee members. I have a couple. Next month, this committee meeting, the PSJC meeting, will be held as a special joint meeting with the City of San Jose's Public Safety, Finance, and Strategic Support Committee, chaired by Council Member Raul Perales, who will co-chair the meeting along with myself. The two main topics that our agencies are talking about collaborating to provide information on, number one, coordination between SJPD and Behavioral Health Services Department on emergency response teams and activation of those teams, and two, on reoffenses amongst pretrial defendants. My office will be reaching out to facilitate collaborative presentations between city and county agencies, and I look forward to fostering some greater harmony between our excellent city and county public safety and justice services. One other note on that, per San Jose's policy on joint meetings, the meeting is being scheduled as a committee of the whole for the city of San Jose, meaning that all San Jose council members and the mayor are invited to join. My second announcement is that as I've mentioned in past meetings, I sit on the California State Association of Counties Administration of Justice Policy Committee, and they've asked me to share that the Board of State and Community Corrections is launching work on a variety of grants designed to ease some of the state's most challenging problems: getting guns off the streets, thwarting retail theft, investigating and solving cases of missing indigenous individuals, and delivering effective mobile probation services to people without transportation. These grants were newly funded in this year's state budget, and the Board of State and Community Corrections is also seeking statements of interest from people with professional and lived experience who are interested in serving on an executive steering committee that will oversee the new grants. My PSJC policy aide, Auden Young, has emailed details on the grants and the steering committee, but I just wanted to be sure to highlight the opportunities here to ensure that our county is utilizing and going after all available state resources and participating in these important efforts. Any other committees have any announcements? Any other individuals have announcements? Seeing none, then this meeting is adjourned to September 8th, 2022 at 10 a.m. And thank you all so much for your participation today.
Thank you, Chair. Bye, everybody.
Take care. Bye.
Bye.
Recording stopped.